Okay, I'm going to go to the lecture now. So it's pupillary examination and refractive error. So I'm going to divide it into a few sections. So the first one is about the pupil. So, so what is the function of a pupil? So what if you are born without a pupil? Can you see? Of course you cannot see. So it is very, very important because it allows the light to enter into the eye so that the retina can get the electrical impulses. Without pupil, nothing can get in. And the pupil is very magical. It can control, the size can be controlled, okay? It regulates so that it will regulate the amount of light. And by having two eyes with two pupils, you can also increase the depth of focus. Other than that, it also reduces the various optical aberrations. For example, so what are aberrations? So aberrations is actually a disturbance. For example, when you look at the light, then suddenly you see the light being dispersed into rainbows, or when you perhaps when you see a straight line but the line has become distorted. So those are the so-called aberration. It can be in the form of color aberration, or it can be in the form of astigmatism. So by having pupil, it actually reduces a lot of glare and it sharpens your images. So when you see the eyes, when you examine the eyes, you must also be able to examine the pupil. Okay, so if you have a Caucasian patient, it will not be very difficult because you can see the pupil directly, like this child. You can either use a normal ruler or you can use this special ruler. But usually if the pupil is small, it's around 2 to 3 millimeters. When it's big, it can go up to maybe 9 millimeters. When it's big, it's called dilated. And when it's small, it's called constricted or myosis. Okay, myosis and dilated. This is a term that you will hear when you go to the eye clinic. Okay, so when you start an examination, you must see the size, it must be round. Okay, size, how many millimeters, you must see the shape. Is it round? Is it crooked? Is it like a triangle? You know, is it square? Okay, and also you must see the color of the iris. So in a different sizes, you call it, if the pupil is different, of different sizes, you see anisocoria. If you see it in a different color, you call it heterochromia. Okay, so it can be quite rare, but unless the patient wear different colors contact lenses, for example. Okay, other than that, if it involves systemic diseases, it is very rare. Okay. Okay, now we are going into the pupillary disorders. Okay, so the disorders of pupillary function are among the most accurate true localization signs of neurological disease. Okay, ocular disease, systemic or local drug can influence the size of pupil. Okay, who can give me an example? What are the drugs that can cause pupillary disturbance? Okay, so one good example is the morphine. So what is the action of morphine to the pupil? Perhaps you guys can tell me later. Okay, so this is the normal pupil of this is actually Caucasian, and these are light reflections. So this is green, brown, hazel eyes. So this is undilated pupil. Normal undilated pupil is about 3 millimeters, and this is a very big dilated pupil. Okay, probably around 9 9 millimeters. Okay, so how does the pupil become constricted and how does the pupil becomes dilated? So now we go into the anatomy and the physiology. So iris dilator muscle is actually supplied by sympathetic and the iris sphincter muscles supplied by the parasympathetic. Okay, so you know that parasympathetic, it dilates your eyes, and the parasympathetic, it constricts your eyes, your pupil. Okay, so why is that? Because, okay, there's a reason behind that, right? So actually the pupillary sizes is actually is the summation of the parasympathetic and versus the sympathetic, meaning if the sympathetic stimulation is more, then the pupil will be more dilated, while if the parasympathetic stimulation is less, then the sympathetic will win, so the pupil will move. Wait. If the sympathetic stimulation is more, it will win, so the pupil will be more dilated. But if the sympathetic is less, then the parasympathetic action is more, then the pupil will be constricted. Okay, so it's a summation. Summation is what? It's a tambahan of these two. Okay, which is more, the one is more will win. It's more like a rubber band. One is pulling each other. Okay, so what is the pupillary light reflex? I think you have known this from a long time ago. So pupillary light reflex, when you shine a flashlight into the eye, the pupil will become constricted, will become small. So a good light reflex needs intact afferent, and needs also intact efferent pathway. I hope I don't have to explain what is afferent and efferent. Okay, so this is a very important picture of a visual and pupillary motor pathway. Okay, you must know all this, okay, from the retina to the optic nerve, to optic chiasm, to the into the visual cortex. Okay, so this is these are the afferent and efferent pathway. All right. Okay, the light enters from the front, okay, from the pupil. This is your iris dilator muscle. Okay, and there are two actually, sphincter and dilated. Okay, so when the light enters the eye, the light is being changed into the electrical impulses by the photoreceptors in the retina. So the electrical impulses travel into the optic nerve, and then it's being divided into two. Rather than being 50%, 50%, it actually becomes into 100% to the left, 100% to the right. Okay, so and it travels behind into the pretectal nucleus. Okay, pretectal nucleus is at the level of the superior colliculus. Okay, from the pretectal nucleus, it travels back into the Edinger-Westphalia nucleus. Edinger-Westphalia nucleus is the parasympathetic nuclei. Okay, and then it comes out at the oculomotor number 3, and it reaches the ciliary ganglion. From the ciliary ganglion, the output is at the short ciliary nerve, which innervates the sphincter pupillae, and finally the pupil become constricted after it's been shown by the light just now. Okay, as I was talking, it took about probably 5 minutes from front to the back, to in the front again, but actually it happens in split second. Once you shine, it constricts. Once you shine, it should be constricted very fast. Okay, so those are the what we call as pupillary light reflex, and you must be able to draw this. and must be able to label this, okay? And you must learn this by heart. All right, so again, pupillary light reflect, we can divide into two, which is the direct light reflex. Okay, once you shine the light, the pupil will constrict to the affected eye. The other one is called consensual, which is the indirect light reflex, where you observe on the other side of the eye. Okay, you shine to the right, but you observe on the left eye. Okay, so in this consensual, if all these pathways are intact, the right eye and the left eye should be able to constrict when you shine even to one eye. Okay, because you can see that it actually divides nicely to the right and to the left. Unless you have one problem here, then the other eye won't constrict. Okay, so you must understand the afferent and the efferent pathway must be intact in order for you to have a good light reflex for the direct and the indirect. Okay, so if you want to test this, usually the students will use two torchlight because we are Asians. If we are Caucasian, you have blue eyes, you only shine one eye to the right eye, and then you will definitely see the other eye constrict. But in an Asian eyes, the iris is very dark. Sometimes you need another torch, low light. You shine from below so that one torch here and one torch dim light here, then you can see the other pupil constricted. Okay, all right. I hope you can understand me from that. All right. However, if you can imagine, if there's a lesion somewhere here in the optic nerve, okay, one eye is normal and the other eye is not normal. So can you imagine what will happen? Okay, so normally you shine here 100% of light, and then it will travel to the back and to the front again with the same action of 100% action of constriction. And also to this eye. Okay, so if you imagine, if one eye, one optic nerve has a problem, okay? So for example, this one is normal, this is the left, this is the right. This is the right eye, okay? This is the left eye, right? Okay, so if you shine here 100%, okay, 100%, travel here to the back, and then okay, and then to the back and then to the front, it's constrict 100%, 100%. However, if you go to this eye, which has an optic nerve problem, probably a 50% damage. So if you shine here with 50% of light, of course, the dilatation also becomes 50%. The constriction is also becomes 50%, meaning it will be like probably half dilated. Understand? Okay, so first you do the direct. Reflex. You want to see how good is the constriction. But in order to test, that's another test, which is what we call the swinging flashlight test. This is very sensitive in order for us to detect the optic nerve lesion. Okay, whereby you must swing the light. Okay, you swing to the right, to the left, and then to the right again. Okay, while you were swinging, you can see that the eye that has problem will have delay constriction. So it will, instead of become constricted, it will become dilated. You know, because of the delay in impulse in the optic nerve on the affected eye. Okay, so you will shine here, it constricted 100%, but when you shine here, it will like be half dilated because of the delay of the impulse going front to the back, and then you come here, and then it will be normal again. You come here, it will be abnormal again. So that's how you test an optic nerve function. If normal, if both optic nerve are normal, then you should have both equal constriction. But if one is not normal, you shine your constrict, you shine the other eye, it becomes like suddenly dilated like that. Okay, and then you come back here, you're constricted again. So that's how you test discrepancy between the two optic nerve function. Okay, all right, you shine here, you shine to the right, shine, it's constricted. You shine to the left, it's dilated. You shine to the right again, it's constricted. And okay, so that's how you test an optic nerve function. If both intact, both should be constricted. But if one has a problem, then it will be dilated on the affected eye. And you will call the pupil as RAPD positive, or you can also call it Marcus gun pupil. Okay, so I will show you the video just in case you haven't seen it. The video that I've shared with you in my lecture, in my Google. Yeah, you can see that. Okay, always start with the normal eye first. If you don't know, then you just start whichever you like. But you will notice that normal eye should constrict as fast, very fast, okay? But in abnormal eye, it will probably have a delay constriction in the beginning. Okay, and then in a positive RAPD, it must be dilated first, okay? At your level, it should be dilated, okay? But because in this video, you can see that there actually are grades of RAPD. I guess there was some glitch there, okay? So you can see that the basic principle is the same, okay? All you need to know is just get a good torchlight with a diffuse light, not with the bayang-bayang, or not with the roll like a camping torchlight there, okay? It must be a diffuse light. And then your amount of time must be the same, right and left. 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, okay? Or 1, 2, 1, 2. It's like that. And the torchlight must be like that. Okay? Not too fast, not too slow, okay? It must be equal. If one eye is longer and one eye is shorter, then you will create a false RAPD. Okay? And don't stand in front of the patient, don't block the pupil, all right? Okay, so now we at the end of our section. Okay, so why you cannot stand in front of the patient? Because in the near reflex, the pupil will constrict. So if in case patient has RAPD, but because you were standing, you're blocking the view, the patient is looking at you, so the pupil become constricted. So instead of this positive RAPD becomes negative, you know. I mean, sometimes in mild RAPD, you get a very vague pupillary response, okay? So in a near, when you are looking to the near, there will be 3 reflexes, okay? Accommodation, the pupil will converge and the pupillary will constrict. So what is accommodation? The lens become thicker, so the pupil will, the eyes will become converging and the pupils will become constricted. Okay, and this is the what we call the near reflex pathway. Okay, so I'm gonna end my video here and I'm gonna start on the second one. All right, see you again.